Sarah, here's that result that you wanted.
Ah, okay, thank you.
I would love to say I haven't got anything. I would love to say that.
Yeah, I'm fucked.
The wait for results is almost over for Harriet, Iffy, Kiefer, and Marco.
I already have genital warts. If I do find out that I have an STI, it will feel terrible.
Hello.
Hi, Kiefer, how are you?
I'm good, thanks.
Good, thank you for waiting.
You're welcome.
So we've got your results back, okay?
Yes.
I did the examination today and we discovered a warts,
Okay.
but we also did a full sexual health screen. We tested you for chlamydia and gonorrhea, which both came back as negative.
Great.
We also did the blood test that was for HIV, syphilis, and hepatitis B and C.
Yes.
They all came back negative as well.
Yes! I'm looking forward to the future now. My results are all clear.
Yeah, are you?
Nice.
Yeah. Take care, yeah, all the best.
Bye.
Just what are you into?
There's nothing I wouldn't do. I have a lead and a white collar. Butt plugs, anal beads, dildos, vibrators.
So Marco, we did the swab for chlamydia, and that was negative. We also did one for gonorrhea, which was also negative, okay? Remember the blood test that we did? Yeah?
Yes.
So that checked you for HIV and for syphilis, which both came back negative, so that's great.
Oh, I'm relieved. I'm just worried about the walks thing.
Yeah.
Yeah.
So how did you find the treatment, Marco?
Painful. Very.
Yeah. Okay, it's not the nicest treatment, but
No.
it will get rid of the wart. What I'll get you to do as well is when you go home, after you've had a bath or a shower, get some salt, put it in some warm water, and just clean the area. That encourages the healing process and speeds things up a little bit for you.
I should rub my dick with salty water.
Moving forward, I've got a feeling you may need some more treatment, okay? The good news is that it's not a big wart, so by next week, this time next week, hopefully the treatment works and the wart has gone.
Okay. Thank you.
No problem.
I'll see you next week.
Okay, we'll see you
Sarah.
next week.
Thank you.
Bye-bye.
Bye-bye. She told me to not have sex for 1 week, and I will definitely try my best to do as she said. You know, like I will. Honestly, I want to have sex tomorrow morning, first thing as I wake up. But like, I will not have sex. Yeah.
Marco, do you think you've learned anything from today?
Yeah, definitely. Yeah, you use the condoms so you avoid all this.
So have you not got any chat-up plans at all? I've got loads.
No, but imagine like having a line rehearsed to tell a girl. It's like, no.
If I told you I worked for UPS, would you let me handle your package?
Very good. Honestly though, the thing, like you're looking at me and I think it wouldn't have mattered anything you said.
So what you mean is you didn't listen to a word that came out my mouth?
No, but the mouth that came out of was very pretty.
Oh, that's cute.
That was the line.
Smooth. I've had no STIs in the past. Oh, it's me. There's always a first for everything. Oh, fuck, if I have an STD. I have been sleeping with my ex. You never know.
Hi. Welcome back. How are you feeling?
Good.
Did you find Jess useful?
Yeah, we had a great chat.
Good. Nervous about the results?
Oh, yeah.
A little bit?
Yeah. Because if I do, like, that is a bit of a downer.
Yeah.
I'm hoping to come out of here with no sexually transmitted disease.
Hello again.
Hey, you right?
I'm fine, how are you?
Honestly, mid-mood.
Yeah? How's things been going in the waiting room with Harriet?
They've been going really well, actually. She's actually a really nice girl.
Yeah?
Yeah. Ticks quite a few boxes, actually.
So I've got your results ready. So earlier on we did some blood tests to check for HIV and for syphilis. Those have both come back as being negative.
So we tested for gonorrhea, chlamydia, HIV and syphilis. Your chlamydia was negative, gonorrhea was negative, your syphilis was negative.
The swabs that I took from you were being tested for chlamydia and gonorrhea. Both of those have come back as being negative as well. Okay.
And your HIV was negative.
Oh,
So all negative.
hallelujah.
How are you feeling about our chat about those edging techniques of bringing yourself really close and then just stopping?
I'm excited, yeah. I mean, I feel bad for whoever has to clean up the hotel room.
So, safe journey home. See you later.
Right,
Bye-bye.
I think that the things I learned today will really benefit me, and that I'll just like see a lot of that nervousness going into sexual situations kind of just go away.
Good day.
Great day.
Okay.
Having a good old flirt.
Yeah?
He's so lovely.
Yeah. Exciting.
See what happens after.
Sometimes though, it takes a bit of a flirt to realise there are other people out there
Yeah,
for
of
you.
course.
You're worth more than...
It's given me that little bit of a confidence boost.
Exactly. And you're more than just being used for sex when he's ready.
Yeah.
You know, if you don't want to be in this relationship that you were sort of in and out of, draw a line and, you know, have some self-worth and go and find a man who you can have an emotional relationship with.
Yeah.
Or, you know, go and enjoy sex as long as it's safe.
Yeah.
You know, if that's what you need to do. Yeah?
Yeah. Can I
Excellent.
go see him now?
You can. I won't keep you any longer. It's been really lovely to meet you.
Lovely to meet you.
All right,
Thank you.
take care. Bye.
Quite a day. It has been an experience. It has helped me a lot. I'm clear. I've bounced back. I've gained a little bit more of my confidence now. I've had a little flirt. So far, he is ticking some boxes.
I've wrote you a poem.
Have you actually?
Roses are red, sunflowers are yellow. I'm digging your vibe, and I think you're real mellow. All in all, today has been a very successful day. There's just been something great around every corner that I've taken so far.
What is my number?
And hopefully the next corner I take is into a pub with Harriet.
Hi.
Hi. Do I have to answer this question? Can I just... Right, I'll take you for a drink and then you can take me for a Mackey's after.
And maybe that should be a deal.
Deal.
Shake.
Sound. There we go.
Doors closing.
Oh, mate.
STI isn't your fault.
They are a bit your fault, come on, like.
I mean, like, common cold's your fault then, you know?
Can't really wear a condom on my nose, do you know what I mean? Like, I don't know.
I knew that was
What
coming.
do you mean?
I knew that was
my
coming.
fault, like.
While Chloe, Tom, and Taps await their STI results,
I don't want gonorrhea, and I fucking don't want super gonorrhea.
I'm sure it's fine.
barman Jordan's about to find out the cause of his bum lump.
The good news is that the skin's not broken, so that would suggest that it's not something like herpes or anything like that. Looking at the spot that you pointed out to me, it was there, so I saw it straight away. It is a little bit red. It is an ingrowing hair, so it's not a sexually transmitted infection, okay?
Cool.
No one's giving it to you, it's not contagious, so you're not going to pass it on to anybody else.
Okay,
All
so
right?
it'll just sort itself out.
It will sort itself out as long as it doesn't become infected, okay? If it's bothering you that much, what you can do is get some warm water and a cotton bud. After you've had a bath or a shower in the morning, just compress it a few times, okay? Just press it down a little bit and it will disappear at some point.
Okay.
Okay?
I was worried it was going to be herpes or genital warts, but up the bum.
I'm going to get you to have a seat in the waiting area for me. When your results are ready, I'll call you back in.
Cool.
Sounds good?
Yep, sweet.
I'm happy now that at least if it does get pointed out in certain activities, I know what it is, and it's going to be gone soon, and it's not contagious. It's just a little lump. But now, part of me is a little bit like worried, like, oh my God, what if I do have some STI?
If it's like, you know, herpes or something, that would be worst case.
Yeah.
Yeah, I need a wee now. I'm a bit, ooh. Ooh!
Go on, Chloe.
Wish me luck.
So we had a chat about some STI screening. The syphilis result came back as being negative, and so did the HIV result, okay? So what do you think you're going to do to sort of keep those results as being negative, like moving forward? I know you weren't keen on using condoms.
Yeah, I think I need to kind of get over that a bit and just think more ahead and not be so in the moment. I'm very much like, yeah, let's just do this, but I need to think first and think, you know, what's safe for me as well, definitely.
Yeah. So since we last met, you went in and had a chat with one of our sexperts, Jess. How did that go?
Really well. So of course, you know, pegging, I feel like I could, you know, bring that in much more now. I feel more confident about that, and to just start small and work your way up, really. And lube is very important.
Yeah, lube is your new best
yeah,
friend.
It really is.
Yeah, like that. Absolutely.
I feel like I really am on a mission now to find the right guy that's into it. Oh yeah.
Hello.
And he comes shopping with me for a strap-on, and we take it easy. It's on both of our terms, and I guess that he just lets me peg him. Oh, you better bloody enjoy it. Bye, guys.
Bye-bye.
See you later.
It's been really eye-opening. I feel like I'm now the face of pegging in the UK.
I am nervous. There's still the odd, like, talking to her. It's like, oh, you know what, maybe. Like, and I'm going to be so pissed off if I've got something.
I think I've got it, you know. No symptoms, but just being sat here makes me think I've got it. Fuck! If I've got the clap, I've got the fucking clap. Oh my God!
Hello, Tom.
Hello.
How are you?
Nervous, how are you?
Yeah.
Every time I was shaking someone's hand, like, as they went, I'd have to dry it from all the sweat that's on there.
How are you doing?
I'm a bit nervous.
Are you nervous? Oh, don't be nervous, honestly.
What have you been feeling nervous about?
Knowing the truth, really.
Yeah.
Yeah, I think it's just been worst case scenario, so.
Yeah?
Yeah.
So Jordan, we took a blood sample from your arm to check you for hepatitis B, hepatitis C, syphilis and HIV. All those have come back as negative.
Okay.
Okay, so this time everything's been great. Yeah, everything's negative.
Oh. So from the blood test that I took from you, I got that tested for HIV and for syphilis. Both of those results have come back as being negative.
I also did some swabs from your throat, your rectum and one from your penis.
Yeah.
So those were for chlamydia and for gonorrhea. Those have both come back as negative.
Okay.
Yeah.
You remember the swabs that I took from your penis? We sent them off to the lab and they've been tested for chlamydia and gonorrhea. Both of those results have come back as negative as well.
Fucking get it. Sorry for swearing.
That's all
I'm
right.
so excited, I was literally shitting myself. Oh, thanks for just telling me that now.
But it's really important to remember that it will not cover anybody in the last 4 weeks.
Yeah.
So if there is anybody in that period that you're concerned about, you should definitely have another screen done. How often will you come to the clinic, do you think, in the future?
How often is it recommended? Because I think that much.
So we'd always recommend if you're having really regular sex,
Yeah.
then having a test every 3 months can be really, really beneficial.
Yeah.
Okay. So I would definitely say between 2-3 times a year would be perfect for you. Until the next time.
Thank you very much.
See you soon.
Cheers.
All right.
See you later.
Bye-bye.
Jordan, we spoke about condoms. Are you actually going to start wearing them? Honest answers.
Yes, I am.
Right.
I'm gonna put one in my wallet and make sure that it's with meal times when you're in the MOMO. Yeah.
One in your back pocket, put one in your front pocket. If you have to put one in your sock, put one in your sock.
Yeah, cool.
All right.
Cool. She helped me realise that maybe I've been doing certain things I shouldn't, and made me think more about why I do the things I do.
I'm gonna go take some of these now. Yes, take them.
And if I am going to do stupid things, just be more careful about it.
Put them in your back pocket.
Thank God the results came back negative for everything. I do feel like I've had a kick up the arse. Even though I'm clean, I'm just definitely not going to put myself through the worry again. I'm just wearing a condom every time.
Doors closing.
Last in is Taps, who's concerned about his results due to a previous syphilis infection.
Hi there.
Hello.
Hello.
Welcome back.
Thank you.
So, we tested you for gonorrhea and chlamydia in the bottom, the
Yes.
rectum. They were both negative.
Okay.
We tested your throat for the same gonorrhea and chlamydia. They were both negative. Your syphilis was positive, but that just shows that you've had past infection. There's no active infection today.
Perfect. Everything's come out clean, so I'm very happy, you know.
So have you found it useful seeing Charlene today?
Yeah, absolutely. It was really eye-opening. I didn't ever think that things from my past, things from my culture could contribute to something as simple as not being able to come during sex. She's told me to proactively push those negative things aside, concentrate on having good sex, and just having the best time I can.
Perfect. That sounds like very sensible advice that all of us could take home, really.
Yeah, I think it's been really good and it's been helpful all around.
Excellent. Well, it's been really lovely to meet you, and have a safe journey home.
Thank you so much. It's been lovely to meet you too.
All right.
I am very proud of my sexuality. I am very proud of the things I have achieved until now. I am very proud that my dad, before he passed away, told me that I have grown up. I am the way I am. I can't really change it. Why can't this be normal too? I think it's really important that the next time I have sex, I just lay back, cut myself a bit more slack, and understand the mystery I am.
Are you worried about your results?
I'm actually shitting myself.
I'm nervous.
It's just you never know, isn't it? If I was to get an STD today, that would be like the end of the world for me.
Hugo, Sarah, and Esther
Have you ever had anything?
are about to get the results of their STI tests.
I had chlamydia at the doctor's and I got a phone call that night.
Just don't pick up, you know?
Oh.
Oh, Esther, to the orange room.
Hi, darling. Welcome back.
Are you all right?
Yeah, you?
I am quite nervous, actually. Hope I've not got something.
Oh. We did some tests for chlamydia, gonorrhea, HIV, syphilis. Just to explain, the tests that I do are accurate from 2 weeks ago.
So, we tested you for chlamydia.
Okay.
And that result came back as negative.
Ah, yes.
Your chlamydia was negative, gonorrhea was negative.
We did a second swab, which was for gonorrhea.
Okay.
And that too came back as negative.
Your syphilis was negative, and your HIV was negative. They're all negative. That's great. Okay?
A lot of weight has been lifted.
Perfect.
Thank you for everything.
Our pleasure.
All the advice I've been given today, I'm taking a lot of it back home with me.
Your blood test for HIV and syphilis, I'm glad to say they all came back as negative. Okay, so this time it's been lucky.
Yeah, this time, all time, hopefully.
Right.
Touch wood. Finding out I'm clean obviously has made me think, I do want to have more safe sex, I obviously think I don't want to just jump from dick to dick like I'm Tarzan or something. Like, I don't want to do that anymore.
I want to see you every 6 months for
Yeah.
a routine checkup, okay?
Yep.
All right.
I'm gonna do that.
Okay, we'll get home safe.
Thank you.
It was nice to meet you.
Bye. Next time I go out, I obviously will be more safe. I would try not to do like one night stands and stuff.
Bye, babe.
Oh, good luck though. Hopefully you're clean.
I'm going to use a condom. I'll know now in the future. I'm protected.
Negative. I want to get a consistent partner. I want to reduce the possibility of being in a situation where you could think, oh my God, I could have something. Yeah, it's kind of made me think, okay, be more safer in the future.
Hello, Hugo.
Hello.
Have a seat. How are you feeling?
Shit myself.
Yeah?
Yeah.
Coming in for a screen today has been a really responsible thing to do. So I've got your results ready. We'll start off with the rectal swab to test for chlamydia and gonorrhea.
Yeah.
That came back as being negative,
Okay.
which means that the treatment that you'd had previously for the gonorrhea has worked.
Okay.
Okay. Your throats that we checked for chlamydia and gonorrhea, they've both come back as negative. And for chlamydia and gonorrhea in your penis, they've come back negative on the swab that I took.
I guess that's good.
Yeah. So I tested you for HIV and syphilis. Both of those have come back as being negative. What lessons have you learnt from today?
That, like, I'm not a bad person. I think for that whole 15, 20 minutes, an hour, if I last that long, with these guys, that some of them I don't even know their name. I feel special.
Yeah. And I wonder if you're making a temporary home in a temporary situation.
And you spelled it out for me. I really am. Instead of trying to find a quick fix for love, I just want a relationship where someone loves me for me.
Yeah, and do you think that's something that you might be open to after leaving here today? Yeah?
Need to get myself on a dating app instead of a sex app.
Yeah.
But I do want to settle down and meet someone.
And how often are you going to go for a screen now?
Every 3 months.
Every 3 months, yeah. All right.
Thank you.
Okay.
Lovely to meet you.
Lovely to meet you. See you soon.
Thank you. I'm actually quite surprised that I haven't got anything because of what I've been doing. But yeah, I've not got anything, thank God. I had a really good speaking to as well, and I just feel like I do need to settle down now and find someone. Like, get the house, get the dog, get the holidays, you know, everything a gay couple do these days. I mean, who wouldn't want to date Hugo?
Sarah, do you mind looking at these for me?
Not a problem, just leave them here for me and I'll sort it.
Do you think you've got an STI?
I mean, I could have been riddled with stuff for months at this point, so let's hope not.
So we're playing like a serious game of roulette right now.
Yeah, well, can't we win? So it's a really shit game of roulette.
Waiting for their STI results are Nick, Chloe, Matt, and Drew.
Oh my God.
I'm here taking the piss and I might be in exactly the same boat.
I don't want this the end of my day to be publicly saying I'm Nick and I've got gonorrhea, but that is realistically a way this could end up.
Drew, who's already been diagnosed with genital thrush, is about to find out if he's got anything else.
Drew.
Okay.
No one tell the whole world, but I have had STIs before, so yeah, I'm worried about my results.
Oh, it's me, hello.
Good luck, brother.
See you later. Hope you don't have anything.
Much appreciated. Same to you, man.
Hi.
Hi, Nick. Welcome back. Hi, Drew.
Hello.
Do you feel nervous about getting your results back today?
A little bit.
Okay, well, I won't keep you waiting any longer, okay? We did some swabs for chlamydia and gonorrhea.
Yeah.
Yeah? So we tested you for chlamydia. and that result came back negative.
Oh, amazing.
Woohoo!
We also did a blood test for HIV. That came back as negative.
Perfect.
We also checked you for gonorrhea, and that also was negative.
Woohoo!
All right.
It's better than the alternative.
It is better than the alternative. We also checked you for syphilis,
Yeah.
and that also came back as negative.
Amazing.
All right. So what we're going to do in terms of condom use moving forward?
Up it from irregular to all the time would probably be a good idea.
Yeah. Please promise me you're going to wear condoms. You've made me a promise.
I have.
Right?
Stick to it.
Don't break it.
Won't.
Right.
Or the condom.
Go home and
Nice
buy
to
some
meet you.
condoms.
Thanks.
All right, darling.
All came back negative, which is really positive, given that I may not have deserved that outcome. I will be a lot safer than I have been in the past. I think it's probably about time I readjusted my ways a little bit. I think I'm going to be a lot more upfront about how I feel about condom use, and if they say no, I think I've got to be a lot more hard and firm with my response to that, which is I actually use the damn condom I've got in my wallet.
Doors closing.
Well, thank you so much for everything.
You're welcome.
Cheers. Lovely to meet you.
Thank you, same to
Cheers.
you.
So got all my results back, they were negative, thank God, like really happy about that. Sarah said to continue to wear condoms and to also just monitor sort of what's going on downstairs with my penis and just making sure that the thrush symptoms don't change or get worse. So there's nothing to worry about.
Are you nervous about the results?
I think I am a little bit now, yeah. There's been a few moments where I've been like, you probably would have something. And it's like, no, you haven't. Like, if I do, I think...
Yeah, you keep going back and forth,
I think
innit?
I don't quite know how I'm going to handle it if I do, like... But I'm trying to tell myself I'm confident, but I'm actually not.
I was confident until you said to me, you never know. Yes! Hey!
Hi, Chloe. Welcome back. How are you feeling about your results today?
I was really confident earlier, but now I'm feeling a bit nervous.
Okay, so I won't keep you waiting, Chloe.
Okay.
So obviously we did a full sexual health screen.
Yeah.
So we checked you for chlamydia and gonorrhea with those swabs that I did, okay? They both came back as negative.
Okay, good.
Okay, so that's good. We did the blood test as well, and that checked you for HIV and syphilis. And they both came back negative as well.
Why did you pause like that? Oh my gosh. Oh, I'm so happy. You did make me scared, I'm not gonna lie.
Well, good, that's what I want to do, yeah? Well, that is true, because, you know, if you carry on having unprotected sex, that just puts yourself at risk. All right, Chloe, well, you know where we are now.
Yeah.
If you ever have any questions, any concerns, come back to the sex clinic.
Okay,
All
thank
right?
you.
Okay, darling. Get home safe. All the best.
See ya.
Take care.
Bye. Negative. So that's good. So at first I was fully confident, but the longer I waited, the more I thought, oh my God, could you imagine? It was really useful coming in. Like, I've learned so much, things I never knew before. It's been really informative. Just because the person I'm having sex with gets checked, it doesn't necessarily mean he hasn't got anything, which I didn't know. No, I nearly died there. She said I always need to use protection, which is a bit of a bummer, but I guess I don't want to catch anything. So it's just something I'm gonna have to do.
Doors closing.
Woo! Best case scenario for me today is find out that I'm absolutely fine still, that I don't have any sexually transmitted diseases. I dread to think what could possibly happen after that. Hey.
Hi, come and have a seat. So we've got the results of your tests. Your gonorrhea and chlamydia was negative, and your HIV and syphilis was also negative.
I'm very happy. I genuinely, for a moment, I was like, you can have gonorrhea, you can have something wrong. Absolutely buzzing with that.
Just to explain, the tests that I do are accurate from 2 weeks ago. Tell me, how did it go with Charlene?
It was good, very, very beneficial. We found the root of a few things. I'd say definitely hit the nail on the head that I'm still very angry with myself.
Okay.
So yeah, I think I've definitely got a better understanding of why I behave in the way I do. And I think I have quite a clear understanding of what I now need to start doing.
That's amazing.
I came into it with quite a carefree attitude, thinking it was just going to be a bit of a laugh. And it's been very beneficial. So actually, thanks for having me. I've really enjoyed being here today. It's been great.
It's been absolutely our pleasure. And so hopefully this is maybe the new chapter.
Definitely.
Onwards and upwards.
I want to try and turn a serious page after today, that's for sure. Thank you for having me. Thank you very much. We opened some serious doors today. Doors that I've never wanted to particularly open, and obviously for good reason, but they were quite clearly the root of my problems. I'm leaving here definitely in a better headspace. Now I'm thinking I'm probably going to delete my Tinder and ignore every single person that speaks to me for a couple of weeks. So it's been quite a transition of a day. I'm hoping that today is a huge step in the right direction to changing my behaviour and growing up a little bit more, let's say. If I can say anything to anyone, especially the fellow men out there, don't bottle your shit up. If you think you need help, there's nothing to be embarrassed about with it, because I've had to reach out for help and it's worked.
Do you think you're going to be all right?
Yeah, you got a text saying one of your recent partners have been in, they may have something, please go and get checked.
I'm really, really nervous about my hair.
Ray, Daisy, Blessing and Alette are about to get the results of their STI tests.
Yeah, scared. Very scared.
Fuck.
If I have something, I'm not having sex for another year.
Okay. Go on, give me that positive information. Right, you're clear. Yes! Let's go. Oh my God.
Ray. Good luck, man.
Hi.
Hi.
Can I have a seat? How are you?
I'm okay, a bit nervous to be honest with you.
Are you?
Yeah.
Hi Ray, how are you?
I'm good, thank you.
Welcome back.
Thank you.
You remember you told me you got that text message
Yeah.
from somebody who had recently been infected with,
Yeah.
with something that we didn't know what it was, yeah?
Yeah.
And we did a full screen today.
Yeah.
So the results are back, okay?
So we tested you for chlamydia, which was negative. Yay! We tested you for gonorrhea, which was negative. Yay. HIV was negative, and syphilis was also negative.
So I'm all clear.
So remember we did the swabs for chlamydia and gonorrhea?
Yeah.
So your tests for chlamydia and gonorrhea have come back as negative.
Okay. Okay, cheers. Thank you very much.
Everything was negative.
That's great, that's positive. I
Yeah.
mean, positive and negative. Thank you.
Well, it's been lovely meeting you.
You too. Thank you very much for having me.
All right.
Bye.
Oh, I thought the way you said it, I just thought you were going to be very good.
All right, so that's good.
Yeah, great
That's
news.
good. Your
Absolutely.
blood test for HIV and syphilis also came back as negative.
Oh my God, thank you very much. That was great.
All right.
Take care. See you
Nice
later.
to meet you, Ray.
Bye.
Bye-bye.
Oh my God.
What's up?
It's clear.
Yeah, go on.
Yeah.
I was buzzing. I actually was buzzing. Chlamydia, gonorrhea, syphilis, HIV, everything like that, completely clear. Nothing.
See you in a bit, lad.
We're feeling.
Feeling good?
Whoa. Innit?
I'm buzzing for you, mate.
Do you well?
Huh?
Do you well?
You've got to throw it.
I'm going to carry on making my choices about by staying protected. There's no sex like safe sex. Safety first, I suppose.
So I'm scared they're now going to say, like, oh, you've got something. Whatever happens, happens. Like,
As well as regular STI tests, both Alette and Daisy had unusual discharge, which has been put under the microscope.
I think I've got BV. Oh, God.
Nobody wants BV. No girl wants BV. If you know what it is, you don't want it. Ah! Come inside and get tested. I'm coming in to get my results. Hello.
Hello, Alette. Take a seat for me. How have you been?
I'm nervous.
So, I've got the results of your swabs back.
Mm-hmm.
So, The gonorrhea and chlamydia tests were negative.
Yes.
And we actually didn't see any bacterial vaginosis or thrush on the slides.
Okay.
So what I wanted to ask, you know, you had sex last night.
Mhm.
Did he ejaculate inside you?
Yeah, that's probably what it is. Still his jizz inside me. Yes. Oh, right.
So that is the answer to that question.
Okay.
Okay. At least we have an answer to what that is.
Yeah. I was so scared. I didn't know what to expect. Thank you.
Bye, darling. Take
See you
care.
later.
Bye.
But yeah, came back and I'm in the clear. So I'm happy. She said that I had some kind of like white discharge inside. And then she realised then after when the test come back that it was just the guy's ejaculation from last night. It wasn't beef.
Doors closing.
Okay, Gillette, won't keep you waiting any longer, okay? So remember we did the full sexual health screen today. So under the microscope, one of the results did come back as positive.
Yeah.
Okay, and that was for bacterial vaginosis.
Yeah. Ugh, terrible.
Yeah?
Terrible, yeah.
Just going back to your previous experiences, now obviously with your ex-boyfriend who made you feel a little bit self-conscious.
Yeah, literally.
And now you've developed this paranoia about the smell down there and it's now having an effect physically and you're getting things like BV. Never wash internally, so don't put anything inside your vagina when you're washing, okay? It's fine to wash twice a day, but just don't wash out all the normal bacteria.
But it's kind of hard for years and years and years. I've been doing this whole like overwashing thing and not using the right things. So to get out of that is kind of tough because it gets so bad. It's hard though, it's your vagina.
It's easier said than done, isn't
Yeah.
it? But at least you've come in, we've had a chat about it and we've sort of recognised the root of the problem.
Yes. I think it needs to just be more in tune with my body. I claim that I am in tune, but I need to be more in tune. I just need to let it breathe and stop being so fussy.
Now, I've got a prescription for you for
Okay.
the medicine that you're going to take to treat the BV,
Yeah.
okay? So it's metronidazole. So 2 milligrams is the dose you're going to take.
Yeah.
So you can have what we call the stat dose. So you can take 5 pills of metronidazole tonight with your evening meal.
Yeah.
Plenty of water. Avoid alcohol for 48 hours because it will make you violently ill.
Oh,
You
wow.
Be throwing up yet.
More than anything, I got great advice on how to be more comfortable with my body, accept it for what it is. Thank you so much.
You're most welcome, Ilette.
And then going forward, not going back to washing with 100 different products that say they're good for vaginas and they're not. Everybody has a scent, and the more knowledge you have about your sexual health, etc., the better off you will be. Knowing yourself and knowing what's normal as a woman, it's key. It's so key. Because little boys aren't going to know. You shouldn't let them teach you about your body.
I only came out to my friends like 3 years ago as well, so I've not really had any guidance in like the gay community either to say what's what.
In the waiting room, Luke, Monique, Sharif and Cayman are about to get their STI results.
If I got HIV now, I'd literally think I was about to die tomorrow, yeah. You do sort of backtrack and think, oh, I slept with this person, did I contract it from them? What have I got? Oh, God.
Oh, way! I did get chlamydia about 6 years ago now. So yeah, it wasn't fun. It makes you kind of like, okay, let me just take a step back.
Hi, my love. How are you?
I'm okay.
Good. Welcome back.
Hey, Cayman.
Hello.
So, Cayman, how are you feeling about the results today?
I just want to know what they are.
Yeah?
Yeah, I don't know what to expect.
So, we did a throat swab, a rectal swab, and a penile swab. Those have come back as being negative.
Right, good.
Okay.
Remember we did the swabs for chlamydia and gonorrhea?
Yep.
So they came back as negative, okay? We did a blood test for syphilis, which also came back as negative.
Yay.
And your HIV test was also negative.
Perfect.
Okay?
The blood test that we took from you, we tested for HIV and syphilis.
Yeah.
Both of those have come back as being negative
Right,
as well.
okay. Good.
Okay.
Yeah.
How are you feeling?
Clean.
Yeah?
Yeah. I'm really relieved. I'm glad I don't have anything that I've been tested for. I'm just definitely going to keep on top of my checks now. Now I've got a clean bill of health, I can just start afresh.
Now, you know you're not too bad with condoms. I just want you to improve that a little bit, okay? And we want to see you every 6 months in the sex clinic for a routine checkup.
Perfect, thank you so much.
All right, my darling, get home safe.
Will do, thank you.
All right, bye-bye.
Bye. So this visit was really insightful. I'm gonna use condoms if I am having casual sex. I'm not really that active at the moment, but what if it comes up? It was really nice talking to Alex, and we spoke a lot about anal sex and butt plugs and all that kind of fun things. For me, I think anal play is the last thing in terms of being completely free and open sexually. So looking forward to exploring the future.
So it came in from today. What do you think you can do to minimise the risk of catching HIV?
Use protection.
Yeah, use condoms when you're having sex. So how are you feeling about taking PrEP? Is it something that you would be interested in doing?
Yeah, definitely. And now I'm more educated, I can protect myself better.
Yeah, perfect. Hope you have a safe journey home.
Yeah, all right.
All right,
Thanks a lot.
then.
Thank you.
Okay.
I think I'm going to stay a lot more protected now. So condoms are something that I'm definitely going to start using more. I feel more secure in my sex life now. I feel like I know what I'm doing more. I feel better about myself now. I know that I'm fully clean, now I've been tested, and I've came to learn about HIV, and I'm leaving knowing quite a lot about it.
Going down.
I got tested like last month, but I've had unprotected sex since that test. Oh.
I haven't had a checker since I was 17. I'm 25. So I'm hoping there's nothing wrong. I just want to make sure I'm clean down there.
Hi, Luke.
How are you doing?
Good, welcome back.
How are you?
How are you? I'm fine,
Nice
thank
to see you again.
Nice to see you again, yeah.
So your results are back. Now remember we did the swab for chlamydia and for gonorrhea. Those have both come back as negative.
Good.
And the blood test for HIV and syphilis has also come back as negative.
Fantastic.
Okay, so you've had a full screen today and everything's clear.
Yeah.
So you came in, we did a blood test just to check for HIV and syphilis. Both of those have come back as being negative.
Great. Negative, negative, negative is all I wanted to hear.
Thank you for coming to the sex clinic.
Thank you.
All right, darling, get home safe.
I will do.
All right.
The STI checks were totally fine. Came back clear. Absolutely over the moon about that. Moving forward with my my sexual partner, I feel like we can actively now search for the third person to have this threesome with. Now I know that I'm clear.
Doors closing.
How has it felt being able to have somebody to talk to today about the things that have been troubling you?
I will say being here has got my confidence a bit higher up.
Yeah?
So I appreciate it, yeah.
Good.
Yeah, I should be more confident.
Yeah.
And explore more. Yeah, man, getting girls to scream my name. Yeah,
absolutely.
In terms of my sex life, I think what I need to do is be more confident, explore more, and just enjoy it.
Bye-bye.
Next time we talk, I'm fresh. When you see me in a year's time, I'm gonna be a new me. Confident Sharif is coming out real soon. My sex game is gonna be absolutely fire.
Going down.
Are you nervous? Are you worried?
Well, I know not everything has symptoms.
Which is worst? Trust me, I lived with syphilis for quite a long time and I didn't know that I have it until I get to the clinic.
How about yourself? Are you concerned about the results at all?
Fuck yeah.
Really, yeah.
With their STI results almost ready, the wait is nearly over for Kat, Carl, Olu and Sophie.
You nervous about getting the results at all?
It's my first time. I've never been tested before.
Carl, good luck.
Cheers.
Oh. I'm nervous because this is a thing. I'm doing this. I could have something. I don't know.
Hello, Carl.
Right, you're right.
Thank you for waiting.
No problem.
How are you feeling?
Nervous.
Okay. Okay, Carl, so we did a full sexual health screen for you today, as promised, and your results are back.
Okay.
So we look for gonorrhea and chlamydia in the throat, gonorrhea and chlamydia in the vagina, and HIV and syphilis on a blood test. I'm pleased to say they've all come back negative.
Thank you.
The swab that we did for chlamydia came back as negative.
Cool.
We also checked you for gonorrhea, and that came back as negative.
Cool.
I feel so relieved now that I know that about myself. I can go about my life and not have to worry until the next person comes along.
We did a blood test, just routine for HIV and syphilis, and that too was negative.
Okay, good.
Okay, so you've had a full negative sexual health screen. All right.
Sounds great.
It was a pleasure to meet you, Carl.
Yeah, you too.
All right.
It's been a pleasure to meet you today.
You too.
All right.
Thank you.
Take care, bye.
I didn't realise how nervous I was to get the results until the doors opened and I saw her sitting there and I was like, oh God. It felt like I was talking to my head teacher and she was about to either tell me off or tell me I got like the best grade in school. I'm off. I know, so sad. Nice to meet you.
See ya.
Other people need to know that getting tested isn't a scary thing. It isn't something that you should be ashamed of. Everyone needs to do it.
Doors closing.
I'm nervous now. I wasn't, but now I am.
I'm a little bit concerned because I had sex with a guy who decided to like take the condom off halfway through.
Did you ask the person, like, hey, have you got anything?
No, I didn't
Is
want
that
to talk to
okay?
him.
Sophie.
Hopefully it'll be all right, but I am a little bit nervous. Who wouldn't be nervous? Yeah, it's kind of like when you're waiting for your GCSE results, isn't it?
Hopefully it will be all clear, but I have a feeling that it's not. I was with a guy and I didn't know his HIV status and he just disappeared. I woke up in the morning and I was like, what the fuck? So I'm a little bit scared now.
How are you feeling about your results?
I'm a little bit nervous.
So we've got the results back from your sexual health screen.
We did some swabs. Those are being tested for chlamydia and gonorrhea, which have been infections that you've had before.
Yeah.
And they came back as being negative. Okay.
Right.
So your gonorrhea and chlamydia test we did from the throat and the vagina, they're both negative. And your blood test for HIV and syphilis is also negative. Yeah?
That's great.
Right. The HIV test, which I know you were really anxious about, that came back as being negative. Yeah. How are you feeling?
I'm feeling relieved now.
Yeah. It won't show up any of the sexual partners that you've had in the last 4 weeks.
4 weeks, yeah.
Okay. So I would be hitting a clinic every sort of 3 months if I was you.
I will do.
Yeah. The syphilis test did come back as being positive. When a patient has been treated for syphilis before, you will always show up as being positive on a blood test. We generally do another blood test just to see whether it's been reactivated or not. We will get that result hopefully within 24 hours and keep you posted on that one there.
It is a weight off my mind. I just felt really, really anxious about whether or not I contracted something because it just seemed like it would be like a double punishment. So it's nice to know that at least like my physical, sexual health is all in good shape.
And hopefully this is the start of you starting to recover, I guess, from certain things. Because I think if you can put the health bit aside, you can then start dealing with the emotional impact to some degree.
Yeah, it's just giving myself time and breathing space, I guess, from here. Yeah. I can do that. It was nice to hear from a professional perspective. Naomi's on the same sort of page as me of like saying that it's not really acceptable behaviour. And yeah, I feel like sort of emotionally validated.
Sophie, it's been a real pleasure to meet you today and I wish you all the best.
Thank you, thanks for your help.
All right, you take care, bye.
Bye. And I'm really pleased to have had the result that I had as well. I was a little bit anxious just in case it turned out that I had anything, and I was clean from everything.
You were quite keen maybe to be hooking back up with your partner. Is that right?
Yeah.
So remember, your test results aren't somebody else's test results. So just because you're all negative, you shouldn't take that as a sign that he doesn't have anything either. So it would definitely be a really good idea for them to go
Get him
tested.
into the clinic.
Moving forward, what have you taken from today?
I'll definitely try to use the condom from now as I'm all clean and I don't want to have like this stress anymore. All negative, all clean. Happy days. Feel relief.
We'll see you again in maybe another 3 months.
Definitely, I'll be here.
Okay.
Thank you so much.
Take care.
Right now, I'm really sure that I'll use condoms. I'm just gonna go home, show to my partner the results and like celebrate with a bottle of wine. I love spending time with him, so it's a little bit exciting. Happy days.